going to talk about the penile enlargement. We have temporary filler versus permanent filler, right? Temporary filler, as you know, you've heard of it, you've done some research. Temporary filler will fill the penis, will make it larger, but is it better? Is it more cost effective than a permanent filler? Now, you know with your research and what you've experienced so far, because you've had the treatment done,
Correct.
permanent.
Correct.
You chose not to do temporary, and tell me why.
Well, I wanted something that was long-lasting and permanent, right? If I'm going to do a procedure like this, I'm going to have a non-surgical procedure, numbing injections into genitalia. I want something that's going to last. And especially from a consumer standpoint, if I'm going to get something done, I want the money that I'm putting towards it to last for years, not to only last for 6 months, 12 months, 18 months. And that's what temporary fillers do, right? We inject temporary fillers in the cheeks, the lips, the nasolabial folds, other parts of the body. The same concept is for the penis. And so when you're injecting temporary fillers, gel fillers, that only last 12 months, guess what it's going to last in the penis? Especially if you're using it 3-4 times a week, it's going to break down even quicker.
That's right.
And you may get some asymmetry. You may get some blebs. And that $15,000 price tag you paid for a certain filler only lasted you 9 months. Where, with your pricing, you pay your fee, lasts you permanently. And you can build on it over time.
That's for certain.
That's the key.
But there's another factor we didn't realize is that when you have temporary filler, right? You put the filler in, right? You're bigger, you feel better, and all of a sudden you're deflating.
Yeah.
How do you feel here?
Yep.
It's a huge
Constantly
impact.
going down.
It's like, wait a second.
Mm-hmm.
That normal penis that you had now is super small to you.
Right.
Okay? It must play on your mind. It has to.
Yep.
I mean, I have to get some patients in here that really have that psychological
Well, the scenario
impact.
is, say you're dating. You're out there dating. You meet your partner.
Oh, gee.
You're injected, right?
That's right. And you start
9 months
deflating.
later, you're still in that relationship, and that partner's like,
What's up?
What happened? Are you okay?
That's right.
What
You're deflating.
What happened there?
Oh,
Then
they're forced to pay more money to get it done.
But also, what's revealed to that partner is that you did something.
That's another issue.
You did something to enhance that, right? And so now you're looking like, wait a minute. But if you're coming into the game already enhanced, that's
You better
steady.
maintain that. You better maintain it.
That's steady.
It's big dollars. I
Yeah.
tell my patients to sell the house and the farm now because it's going to cost a fortune. A fortune. And I think what we do is we establish fees that are very reasonable.
Very reasonable.
For what you're getting,
Yeah.
I think it's the best investment. Best investment.
But you and I see it in consultation. We're getting these men who have had temporary fillers, and now they're seeking something more permanent after they're already put in $10,000 to $20,000 in for temporary filler.
Yeah. It's sad because sometimes their budget won't
Yeah,
allow
they
it.
won't allow it.
But
Yeah.
they find it, though.
Mm-hmm.
Eventually, they're going to find it. The thing is, they have to find us.
Yeah.
You know, if they could find us, it's a done deal.
Yep.
Okay. There's no one in their, logical brain to say, hey, I'm going to spend $10,000 for this every year versus $10,000 or 20 tops for the rest of my life.
Correct.
So it's a wonderful thing.
Yeah.
And that's what you appreciated too, obviously, and so forth. So temporary fillers, I'm not necessarily against them. I had just a handful of patients, not a lot, that said, you know what, I don't know if I'm going to like being permanently larger. So they'll experiment with a temporary just to see how it is.
Right.
And they all come back.
They all do.
Okay. But that's okay. They could spend their 10
Start
grand,
there.
fine. Put the temporary filler in, live with it, see how they feel. And they usually come in, that's it. It's a done deal. But that's the only reason to justify temporary filler.
Yeah.
I don't think there's any other reason to justify it. Unless, if a patient doesn't know about permanent filler, that's their solution. I'd rather have fat than filler.
Right.
Okay, temporary filler, I'd rather have fat.
Yeah.
Okay. Now, fat sometimes works very well, but sometimes it just doesn't. I mean, I've had cases where let's say here's the penile shaft here. I mean, a lot of the fat died, and you wound up with like a big bulge here. And we could balance that with filler.
Yeah.
Okay, we can do it. But there's obviously issues with fat. But experienced doctors like yourself, let's say you decide to use fat in the penis, you probably get pretty decent results. But you cannot target like you want, like you do in the behind.
Right.
You just flood in the area.
Yeah, you're flooding.
Flooding this area.
Yeah.
Sometimes it won't settle to the base.
Right.
Sometimes it won't settle here, and you
migrate.
get like an abnormal shape.
Yeah.
So I've had patients that had lipo done, or fat transfer into the penile shaft. So when I get them, I say, okay, I could target, just like what you do in the behinds. Okay, I target perfectly. If let's say it's narrow here, on the distal area where the glands is here in the shaft. I could target right here, balance that out, leave this alone because it's fat, and build this out and make it look more tubular and balanced. It's a wonderful thing.
Yeah.
It really is super.
Yeah.
So a lot of good stuff with the permanent filler. So you guys interested in this type of a filler material, penis enlargement, and so forth, just call us. We'll give you an idea of what's going on. Check out our website. We have a lot of information there too. Dr. BBL is going to be finishing or advancing his practice in regarding his BBL technique and also doing the male enhancement. You're going to get real busy. You might as well look for a partner. I'm telling you. Between lipo for the women, I mean, you got the best of both worlds.
I do. I do.
So
I'm
get
excited.
ready.
That's why I'm excited. I'm a relatively still young physician, and I'm very excited about the future and what we have available to us to treat patients.
Well, it's going to be a dynamite situation. I'm not going to do fat transfer. I got enough male
You
guys.
got
in
stuff
here.
on your plate.
Yeah, too much stuff on my plate, but that's exciting though. Well, listen, my friend, it's good to see you. Okay, we'll chat again.
Yes, for
Okay,
sure.
a lot of stuff to follow up on, and for the audience there, just keep in tune, keep in touch, and we'll have some more interesting podcasts for you.